Welcome to Transport Talk COVID-19. Today we're talking about cross-government collaboration in response to the coronavirus pandemic and the impact it's had across New South Wales. And we're joined by leaders of various agencies from New South Wales Police, Commissioner Mick Fuller, thank you, Secretary of Health Elizabeth Koff, Secretary of Transport Rod Staples, welcome, Secretary of Customer Service Emma Hogan.
Hi.
Thank you very much for joining us. Commissioner, I'm going to come to you first. Let me start with why coronavirus has required a response that's essentially unprecedented, even in light of things like recent bushfire tragedies and flooding.
Well, I think that, and the community gets this, it's a global pandemic, but what that means is it's a global emergency. And yes, we've had bushfires and we've had floods and we've had storm, but in our generation, no one would have seen an emergency like this. And we've seen the potential devastation it has caused in other countries around the world when they perhaps haven't managed it as well as we have in New South Wales.
What would you say to that, Emma?
Yeah, I mean, it's unprecedented when we first heard about it. I think the focus was on why is everybody flooding the shops and hoarding things, to is this really out of control, to oh gosh, what's happening, to oh, now I'm not allowed outside my house, to so it's had iterations, I think, that the public have not ever experienced before as a whole community. You know, the thing I always think about with bushfires is there is a cohort that happens to, and then there is a cohort of people who have empathy for everybody that happens to. This is happening to everybody in some way, shape or form, and it's meant an adjustment for everybody. So I think we haven't seen anything like it, and that's why we're responding every hour, every day and working it out. Yeah.
And Elizabeth, obviously health had been on the absolute front line here. How would you describe the magnitude of work that has gone on in the last couple of weeks?
Absolutely enormous. Everybody keeps using the word unprecedented, but really what we've experienced is a complete shift to what we traditionally call business as usual, running public health services, running hospital services, running community-based services. The whole pandemic environment has shifted everyone away from business as usual. So our public health units are focused specifically on contact tracing and isolating cases and recording cases. Our pathology services have gone into overdrive with the number of testing, and we're getting up to 5,000 tests every day, which is excellent for management but is an extraordinary workload. Surprisingly though, more than anything else, what's happened since the social isolation has come into place, hospital activity actually has declined. Something historically that's always been very high profile in health is overburdened emergency departments, surgical waiting lists, etc. It's caused really a pause in that hospital activity, which has provided us time to prepare. And I think the overseas experience has really highlighted to everyone the need for good preparation.
I was about to say that one of the biggest concerns, I think, from the public's perspective as well going into this was the concern that hospitals would be overrun. So the fact that that hasn't happened is quite extraordinary.
Yes, we're delighted. We bought a little bit of time, and it was only through that social distancing and those restrictions that have been imposed that really gave us an opportunity to redesign what we needed to redesign to be prepared. We sound like Boy Scouts, but we are prepared.
Yeah. Rod, how would you describe the role that transport has played in the pandemic?
Well, certainly I look at Elizabeth and what she's had to confront, and Mick as well, in terms of right on the front line. I feel that transport's been a little bit more working behind the scenes, and actually personally been quite relaxed about that, and it's been nice not to be the agency, but no part of government can just sit back in this pandemic at all, and I think transport's had a big role in, particularly in the freight logistics space, around keeping the goods moving. That's been a massive priority for us, whether it's to get things to hospitals or get things to supermarkets. We all know what the experience is like trying to go shopping at the moment. So understanding that role has been really important. The demands on other parts of our transport network have been weirdly quiet. And that's been an odd thing for us to sort of comprehend, but now we're getting a bit opportunistic about what we can do while things are quiet.
Yeah. And Emma, customer service work, just for context of those viewing and also listening at home, just a little bit about each of the agencies' responsibilities in this pandemic.
Yeah, so the Department of Customer Service is playing sort of three major roles. The first is Service New South Wales, which is where the COVID hotline is. So you can either go into a service centre or you can make a call to Service New South Wales and they will help you with any COVID matter, whether they're directing you to the federal government, directing you to health or helping you themselves. The second one is we run the nsw.gov.au website, which is sort of the central source of truth for New South Wales, and we're working very heavily across all of the clusters to make sure everything on there is accurate. And then the third is really our data analytics centre, where we're centralising as much data as we can to help the whole sector make informed decisions. So we're dealing with the public but also playing a behind-the-scenes facilitator role.
And Mick, I guess most people would think that what you do is pretty obvious, but from a police perspective, what has your main role, do you think? How would you describe it?
It's probably broken into two, and the first side is the emergency management side. And you know, about 3 weeks ago, we reached a point where just the pure logistics and the aeroplanes coming in and the passenger ships, that was really eroding health's ability to do what they do well, which is manage the health system and keep us so safe physically and mentally. So we came in to assist health with the back of scene, you know, stopping the cruise ships from coming in, managing the passengers that are coming off our international flights, the security aspect of the operation. And then, of course, there's the other side to it, which is business as usual, and crime is still happening. And thankfully, like the health system, is crime in most areas are down, and we're watching things like domestic and family violence very closely. But really, in terms of alcohol-related crime, domestic and family violence, at this stage, we're seeing a downturn, which I think it speaks volumes for the New South Wales community during a very difficult period, that we're still a very safe state.
And you just mentioned there the collaboration. Well, you didn't mention specifically the collaboration, but the when you needed to bring in all the people that were arriving from overseas, cruise ships or otherwise, but particularly let's talk about the airport. When they arrived by airport, thousands of them over a number of days, it was a very close collaboration between a lot of agencies to get those people through the airport and then into quarantine. Who wants to talk about, Rod, I'll come to you first, the collaboration between transport, health, police, probably customer service. I might be naive in saying that, but there was a very big collaboration there.
Yeah, obviously one of the key measures for containing the virus was to stop people coming in from overseas with the virus. So I think the protocols that were set up at the airports, and then the transport logistics behind the scenes there about those that are well being transported, those that potentially are unwell being transported separately, keeping all that apart. Containing it so that you could be really confident that this disease wasn't being spread as people came out. A lot of work went in across all agencies. The part that Transport played was to set up a special bus service to move those people from the airport to the hotels in partnership with police and health to make that work. And yeah, it's really served its purpose. I think it's been one of the key strategies that we've now actually got such a low rate of the disease spreading.
Elizabeth, I'll come to you as well, because again, we want to talk about the collaboration here between the government, because it's not always seen. In fact, the government's quite often criticised for being operating in silos, but this is such a great example of everyone coming together and doing an extraordinary job to try and keep the people of New South Wales safe during an unprecedented time, as we said. What are some great examples that you've got of the work that all of the teams underneath you all are doing?
Look, I think we got used to working collaboratively pretty well during the bushfire. That was really one of the prominent times in my mind where the whole of government is required to respond to what we're experiencing. So it was good that we had the training wheels on through the bushfire period, because our relationships, and that's how relationships and collaboration work. You feel happy to pick up the phone to Commissioner Fuller and say, hey, there's something going on, or to Rod, or to Emma. I have no hesitation. And that really gives the authorising environment then for all our staff within the agencies to collaborate and work together and recognise the value add that each one can add to the processes that we're trying to achieve. So police have been extraordinarily supportive in procurement for us, because what's been playing out publicly is the shortage of personal protective equipment, or what we call PPE. And international supply chains have been significantly interrupted due to the demand that's internationally required for PPE, and police have brought their expertise, which I never would have thought go to police to help us with procurement, but it's been excellent.
Lawful procurement.
Yes, yeah, of course. But those sort of things have really enabled us. While PPE is absolutely critical, procurement may not be our primary skill because we deliver healthcare. And traditionally, we're used to have all the supplies we need delivered because supply chains work well and our normal vendors are available and ready to provide. So that experience, I think, has been extraordinarily useful for us in being able to support the community and the healthcare system to deliver the care.
And Mick, of course, the police are frontline here and a combat agency. What are some great examples that you've had of all the support you've had from the other agencies?
Look, and I think we are under the emergency management legislation. We're the coordinating agency, so we get it. It's about friendships, and friendships come together in difficult times. And I think the norm was put New South Wales Fire and Rescue, and the bushfires here, and you've got the SES. But it's a really different one now. You've got transport and services and health, and really the whole of government has come together to fight this emergency, the virus, in a sense like I've never seen before in my 32 years. So the coordination between agencies and the friendship, and we all want the same outcome, which is really saving New South Wales from the pain that we've seen in other countries, and really the efforts of our health practitioners right through to our trained drivers and our frontline workers on desks trying to help people, and clearly our police and emergency services that are still out there at the moment. Like, I think we should be proud of all of those who have continued to come out and work during a difficult time.
And on that note, let's start with police because we're talking about it anyway. How are your frontline people doing? How are all of your teams doing?
I think what we do well now is message to our people, and we spend an enormous amount of time trying to keep them updated. I guess this is all part of it at the same time as well. If you look at North America, the biggest police department over there, they have around 30,000 police, around 6,000 are COVID positive and off sick, just to give you some sort of context. Now, New South Wales Police, we have 6 officers who are COVID positive, all from international travel. So when you start to think about how well we've managed this, it's not just the pictures that we see from overseas. There will be so many lessons learned from other states or other provinces around the world where they've seen devastation from the virus because they potentially didn't handle it as well as we did.
Emma, how are your people going at customer service?
Yeah, so I've got about 8,000 people in my remit, and about 40% of them are working on the front line in service with customers every day, and the rest are working from home, and a teeny tinier amount are still coming into the office. So we've had to manage things in a very different way than before. Our service staff are okay. There is an amazing culture in Service New South Wales which has served us really well here, which is their first priority is always how can we better serve the customer. A super quick example, we don't like any barrier between us and the customer traditionally. We try to make it as kind of user-friendly as possible. So instead of saying, okay, we're going to put screens up, we went and asked everybody, what do you want us to do? What input do you want to have into how we treat the customers, balancing that safety message and really including our staff in those decisions. In the back of house, I think same everywhere. Everyone's getting used to working from home, trying to work out ways to be oriented with teams and those sorts of things. But I think the whole sector is feeling that, and I think people are getting into a bit more of a rhythm with that now. Perhaps a little bit challenged with homeschooling and those sorts of things thrown in, but I think it's a time for empathy and kindness, and we're certainly trying to live that with all of our staff to make sure they can do their very best for the people of New South Wales.
And Rod and Elizabeth, in terms of health and transport, we've got a huge amount of people that work at home. We've got over 10,000 working at home in transport. We've also got a huge amount that are on the front line, and there's that anxiety that goes with being on the front line in one regard, but then there's also self-isolation that has sort of impacts people in a different way, and they're not out there and they're not having that human interaction. That can impact negatively as well. What would you say the people are, how they're doing at transport, Rod?
Well, everyone's anxious, maybe for different reasons, but everyone's anxious. And like on the front line, obviously, because they're out and about and they're interacting with the customers, The big lesson for me is actually getting in, understanding every individual role and looking at what their exposure and risk is, and actually coming up with the right treatment for them is the best way to do it. There's no sweeping generic solutions would be a big take. Interestingly, I think for the front line as well, there's a bit of sadness at the moment. They love serving the customer and they love seeing things busy. And when it's quiet, it's not quite the same. Their job doesn't have the same impact. So it's an interesting sort of reflection when you get out and talk to them that they're anxious for their personal safety, but they're also a bit sad that the community is going through this at the moment. Behind the scenes, definitely that whole shift, there's a lot of enthusiasm about working from home and the sort of different flexibility that provides, but it does come with its challenges, particularly while kids are at home. Like, speaking from experience, trying to do a live stream with kids running around in the background, it has its challenges, and you're on tenterhooks occasionally, but
makes you human, though.
But it does make you human, and I've sort of personally loved actually seeing behind the scenes and actually seeing the people that I work with in a way that I haven't seen before, which is actually really inspiring.
And Elizabeth, the same question to you. How are your people going on the front line and behind the scenes in the different work environments now?
Look, at the hospital setting, I think fear and anxiety are running high. And why wouldn't it be? When you look at what's happened internationally with the mortality rate amongst healthcare workers and some of what's been experienced in the US, in Italy, and the NHS, because the healthcare community internationally is quite closely knit. And part of the challenge for us is to get the messaging out there that not all settings are the same, because the transmission rate is so different. And that's what I think prompted the initial wave of anxiety when people looked at what happened in Italy. They thought the same thing that happened in Italy was going to happen to us here in New South Wales. And dealing with clinicians that were saying, we have to get ready, it's going to be horrendous, and we have to have the appropriate equipment, which we agree with. They do have to have that, but it's allaying that fear and conveying the information and conveying the appropriate settings on which the protective equipment is required. In terms of the pleasing thing about this, we've changed lots of models of care from traditionally the way we deliver healthcare. So we've been slow to move with digital consultations, and for those who have sometimes experienced outpatients clinics, they can be an appointment of endurance while you wait for hours and hours till it's your turn. So the digital shift, I think, has been excellent and is something we're keen to maintain when this is over. And in terms of the working from home practice, the ministry, I think, was one of the last bastions to move to a more agile work approach, and I think some of the staff are quite enjoying it, but the social isolation is something that's coming through. So that's why I think it's wonderful you've got these in transport. It's an excellent idea to keep in touch with your workers.
You just touched on the digital era, taking off, particularly at the moment, which we've seen across the board in the last couple of months. This is kind of an opportunity, an extraordinary opportunity to look at new ways of working. How do you say that have played out in your individual agencies now, and how can you see that playing out in the future? Do you think we'll start to have a stronger online component of work from now on? Rod?
Look, I think the thing that's really unique in this moment is we've got such a clear common purpose, not just within transport but across government, and it's amazing how when you have that, it drives decisiveness and joined up thinking. That the challenge is how we can pull that through and be more like that after the event. I'm positive and confident about the opportunities, but also know that we're going to have to push really hard as we come out the other side of it. We are in a pretty privileged position as a public sector as well, that we actually do have most of our people still employed. So we've got to be quite grateful that that's a great platform for us to be able to step off from and to be able to sort of drive improvements in the way the workplace operates from a position of employment.
I'm actually just going to seize on that for a moment because I think it's an important point to talk about from everyone's perspective. There has been a tonal shift in society. We have hundreds of thousands out of work, possibly more down the track. You're having people that will be coming out of isolation in the next couple of weeks / months with a different outlook on life. Perhaps there could be a rise in mental health issues. We are seeing that. How do we, as the agencies of government, approach people in the public, whether it be, in terms of finding them or dealing with them from a health perspective or even on the transport and misdemeanours? customer service obviously plays into this as well, but how do we need to take a more empathetic approach? Emma, that's what you mentioned that before. Is that what we need to do moving forward?
I think the main thing is that the health orders are serious powers, and they have restricting us like other pieces of legislation have never restricted us. But I think it's important to remember that they're not forever, that they're a maximum of 90 days at the moment, and all the great work that everyone has done in health and transport and services and police and the community means that transmission rates are so low that there is so much hope in terms of what the next step will be. So I think what's important from the community's perspective is that this, whilst there will be a new normal, isolating at home and all of the restrictions won't be forever. They're to get us through a very difficult period, and then no doubt the challenge for our leaders is that how quickly do you bring us out from this. So the health orders won't be around forever. They're struck for a maximum of 90 days, and obviously the Premier has to make that difficult decision when is the time we come out. But no doubt coming out of it that mental health and there'll be other social issues that we know have happened after the 1990 recession, that we know that there was a lag from that recession for 15 to 20 years for some social issues. So that these are all the things that would be on the minds of the Premier and Cabinet at the moment in terms of, how long do we leave the restrictions in place? And unfortunately, there's not a rule book for this.
No.
And that's one of the great challenges.
And Emma, you guys are on the front line. You're speaking to people across New South Wales every day about certain issues that they're facing.
That's right.
And the support that they need. What are you seeing?
So we're definitely seeing a real shift, actually. It's been really amazing to watch the consumer insights data. We've gone from, there's a real confidence now in government response. There's a confidence that the restriction measures have made a difference. Over 90% of people believe that they can personally make a difference in helping save the lives of others by participating in the the community instructions of what to do. I think we are seeing a correlation between self-isolation and, I wouldn't say mental health in the clinical sense, but in the more perception sense of people feeling that their mental health is perhaps, and their well-being is not where it was because they're into a routine of self-isolating now. So we're watching that all the time. But to the Commissioner's point, this isn't a season that we've seen before where we can watch people go in and come out and we can recognise it. We have to look at the data every day, every week to understand where the changes are and keep offering different services and solutions to people to help them get through this. So the data is important.
Yeah. Thank you. One of the things that strikes me about this particular situation is that it has had many, many challenges for each of you and all the staff working underneath you as well. But what, Elizabeth, has been the biggest challenge for you in the last 6 weeks?
Attempting to provide leadership in what is an unknown environment. It's, as I said at the outset, business as usual immediately got turned upside down on its head. So what was our normal rhythm of management, of processes, of KPIs, etc., immediately got parked while we attempted to get our heads around what we were dealing with, and also the directions from National Cabinet, because the whole governance structure around the recommendations that were made nationally changed significantly, plus then the response of New South Wales, how that changed, and as we said earlier, working in partnership with all the other agencies to do what needed to be done. It was pretty chaotic, and it was a completely different rhythm to what we've traditionally been used to. And I guess there's a fear of unknown in that and uncertainty because we didn't know where it was going to go. But one thing I've learned over a long time in leadership positions, that leadership requires courage, and that's something that I think has been a very necessary commodity. And that courage, I think, brings with it some resilience and confidence that you can navigate through this uncharted territory.
Mick, to you on that, biggest challenge?
Yeah, I think that the health orders that have been so important in really shaping New South Wales communities' minds around isolation, the importance of it, at the same time are presenting some challenges that New South Wales Police and the community have such a great relationship, but probably a piece of legislation has never challenged that friendship, better, more than it has. So for mine, it's about what's going to be the lasting challenge when the health orders are closed down, and that's about making sure that the relationship between New South Wales and the community hasn't been damaged as a result of our enforcement of those health orders. So I think for me, longitudinally, it's really about making sure that the community and the relationship with police continues to be strong even through a very difficult period. So that's the most challenging thing at the moment, and I think probably going forward will be one of the biggest challenges.
And I'm going to talk about that just while we're on it.
Yep.
How have the police or your frontline police found implementing directions that are not necessarily always clear?
I think the health orders are clear, but the messaging on top of that, the good advice sometimes gets mixed in with it. Like, good hygiene is not in the health orders, but we will talk about good hygiene for years. So, social distancing is not actually in the health orders, but we will talk about that for years. And these type of conversations often get blurred into what the health orders are. Now, the health orders are, clear and prescriptive. I think the other part is that good people in the community don't want to break the law, and as Emma said, they want to be part of the solution. So people are hypersensitive about, can I go out, can I drive with my daughter on her learners? And I think there are lots of questions because people legitimately want to do the right thing. But I think if you, the New South Wales Government website is really clear in terms of what the orders are, what you can and can't do. And when it comes to other good, the Chief Medical Officer and the Premier's advice around hygiene, social distancing, these aren't orders, but this will be the new norm, and the Premier has been clear on that. So I think it's great that people care and people ask the what ifs, because it shows to me that, as Em said, that 90% plus people feel as though they can save a life, and it's a really powerful thing.
Rod, biggest challenge?
It's hard to sum it up in one, I'd have to say, Kate. But I think for us, we're not front and centre in the policy decision making. They're being made for health reasons and really good reasons. So for me in transport, it's been about how to adapt to a new policy setting and not to overreact or underreact. So if you overreact, it sort of just blows up in front of you. If you underreact, then you get some problems such as a freight logistics chain barrier that you didn't see. So just calibrating that and have it being really measured. I think the confidence in the workforce that you've got their back and you really care for them and actually genuinely get out there and try and understand what their issues are and sort of give them the sense, as well as customers as well. They want to know that you're trying to keep the system as clean as possible and keeping them as well as you possibly can as well. So just navigating through those couple, I'd say starting to shift into that sense of the economy, the social impact. To me, that's starting to weigh really heavily as we get control of the health side now. That's the big thing for all of us in government now. How do we navigate our way through, because they're long-term consequences that we all need to manage.
And Emma, the biggest challenge for you in this climate?
I agree with Elizabeth personally. It's been leading with courage and leading the team and keeping it together and keeping your energy high to be able to do that. Professionally, though, it has been to communicate the 7.5-8 million citizens in New South Wales, and we play the central role of collecting what each cluster wants to say and interpreting that into clear messaging for the public in an environment that's a little bit unclear sometimes, and trying to get that. The Premier will say something at 8 in the morning, and by 8:05, the website goes crazy and the phones start to ring about what does that mean, what else can I do, and being really clear and having staff ready to answer those questions and feeling confident in doing that. That's the biggest challenge, is making people feel informed so the citizens of New South Wales know how they can play their role in this, and that's really challenging. Yeah.
Now, the road ahead is not straightforward, as we know. We'll start to open up in weeks or months ahead. Elizabeth, what do you see the way forward as being for health?
Look, we're still quite conscious of the fact that if transmission spreads, our ICUs might be under significant demand, and that's the underlying anxiety for everyone across the state. But we're really confident that we've done the appropriate planning in terms of tripling and quadrupling our ICU capacity should we need it. So that's where we feel confident. The issue that I think has been overlooked in many people's minds, however, is what we call the non-COVID conditions that may be ignored during this period. I know you touched on mental health and wellbeing after the event, but what we're seeing now in terms of the decrease in emergency department activity, the decrease in surgery, we did stop breast screening. There may be actually people there who the deferral of their care may have longer term health consequences, and they're the groups that we really need to keep an eye on going forward, and there's a couple of vulnerable population groups in those categories also that we need to ensure that we provide intensive clinical support for.
Mick, it makes sense. Lead agency, will end on you. That question going forward, what do you foresee as challenges, and how would you like to see it all play out?
Well, I think it'll go from a health-focused emergency, and you'll find it will move more into economic issues going forward, because the money does matter when it comes to housing, when it comes to health, when it comes to services, when it comes to law enforcement. So I think at some stage there will be a tipping point, and we'll move from health into finance, and you're seeing more economists around the table now than you are doctors, which is a good sign. But I think from my perspective is that we all want to see New South Wales come through this healthy and get back to being a prosperous state, and we can do that. We really came out of the bushfires in such a strong position, and I think the people of New South Wales should have such great hope that there are so many good people in health and transport and services and other agencies that are out there working for them, and that this is not the new normal necessarily, and we will come out of this together.
Mick Fuller, Commissioner of New South Wales Police, thank you. Elizabeth Koff, Secretary of New South Wales Health, thank you. Rod Staples, New South Wales Secretary of Transport, thank you. And Emma Hogan, New South Wales Customer Service Secretary. I really appreciate your time. Thank you very much, all of you.
Thank you.
Thank you.
Thanks, Kate.